Welcome back to another PCBH Corner. I'm David.
And I'm Bridget.
My mind, it will be interesting to see how this video does, even after we get done recording it, if we actually want to release it. So Bridget and I, we actually, in this past November, we got to go to a retreat in Nepal that talked a lot about compassion within medicine, and also talked about resiliency, how to approach patients. And one of the, I think, really big takeaways, at least for me, was this conversation that evolved about, burnout within healthcare and how to be well in healthcare.
Yes.
So I wanted to maybe have a conversation for both of us. Wanted to see how it evolves within us, and then also to get other people's thoughts. As always, after watching this video, reach out to us with comments, thoughts about where your mind goes. Two things that I wanted to start off with. The one was, we had one of the teachers that was there said something pretty profound when someone asked about the United States healthcare system, and he was from Nepal. And one of the first things that he said was, what did he say? How did he say it? It's better to have a healthcare system than to not.
Yeah. Like it wasn't, at least you have a healthcare system, was it?
It was something related to that. It's like, it was something to the point of him saying, hey, you all have a healthcare system. We barely have a healthcare system at times.
Yeah, I think, it's coming back to me because it was like, yes, there are difficulties in the United States healthcare system.
Yeah.
And at least you have a healthcare system.
And so that isn't to say, and the one thing my mind always gets worried about with these videos, and it's becoming less worried, because we want these free-flowing conversations, and we want people's minds to be, challenged and assumptions challenged.
Dare we say, being provocative?
Exactly. And so the idea is not to say like, oh, the United States health system is great, and hey, even though there is struggles and challenges, who cares, at least you have a healthcare system. It was a very profound point, though, about recognizing sometimes the focus of all the things that are wrong with the health system. Sometimes that takes away from the fact that there is one that we are still a part of, and the honor that it was to be a part of.
Yeah, and I think that, for anybody who watches the PCBH Corners, I don't think that we're provocative for no reason. I think that if you really listen to what we're saying, we're coming from a genuine place, and just bring up what we feel are genuinely issues that exist, and in the healthcare system, in medicine, and a lot of times in PCBH specifically, such as, primary care. So yeah, I mean, I think I know what you're trying to get at here.
Well, the second thing, as we'll come back to that, the second thing that was really profound that he said, or the training was, and this was from both the teachers that were there, was that a lot of times, from their perspective, what is defined as burnout is oftentimes what our one friend would say ego cleaning, it meant to say ego clinging, that a lot of times it's because of the things that we're battling within us,
ourselves.
That, and we might want to look at that a little bit more, which was, we're in a room with 20 to 30 other medical professionals. Didn't hit home the greatest at times.
Yeah, it was like, okay, it kind of felt like a little bit like victim blaming.
Yeah.
That because the medical providers were like, hey, we're in this really toxic system. How do you transform yourself?
It was, how do you transform the system? And,
that's true.
And they would be like, you don't. You transform yourself. Yeah.
And so, right. It was kind of like, how do I emotionally handle myself in this toxic system?
Yeah.
I'm going to cough here for a second.
Yeah, go ahead. No worries. Yeah, and so that's the thing that was really, really intriguing. So I think that's where almost kind of like what we did at the retreat. We're not discarding all the realities of the United States healthcare system, the frustrations, and
definitely don't want to be victim blaming.
Not at all.
And saying that if you're burned out, it's your fault.
It's almost kind of like my mind was excited for us to maybe talk about, like, let's carry that statement and accept it a little bit and have a conversation about it. Like, what if it is a lot about what we're holding on to. And the one thing, and I can't remember who said it, if it was the second teacher or it was the first teacher that said, we're trying to conquer the universe of someone else, and we can't even conquer our own universe. And how much of that plays into this idea of us needing to save people, needing to fix people, and how much does that erode us at times?
Yeah, I definitely think we should dive into this, and it's probably my own anxieties.
I know we might not ever share this video,
but this is not about victim blaming.
Right.
This is not about saying that the United States healthcare system, or whatever country you're from, whatever health system you're in, that there should not be changes that are needed to be made.
Absolutely not.
Let's just, like you said, I don't mean to woman-splain this to you. Let's just imagine for a second that there's a bunch of other talks, there's a bunch of addressing all that other stuff. And what you and I are going to home in on is, so if we are in a toxic system, outside of making external changes, what are some strategies that we can do? And what are some things for us to think about?
Yes. That might be playing into that. Really well said, because both can be true.
We know that, right?
And I think one of the things that was really profound about the conversation was there was constant conversations like, how do we change the system? How do we change the system? And, I think very appropriately at times, the speakers would just be like, look, it's not saying a system shouldn't change. It should. We're in the system now. So what are we going to do?
What are you going to do?
What are you going to do?
And what are you going to take into account? Into your own mind about, like, maybe what are some of the internal factors that are contributing to this? So what were some of those internal factors from what you remember from their talks?
The one thing that I really appreciated, there was a couple of main things. I should have written them down, but that's okay. I'll try to remember. One of the things from the beginning, and you have done a great job with me with this, is that we have to take care of ourselves physically, spiritually, mentally, that there has to be a focus on us putting in the time and effort to do that. And so the talk centered around sometimes about that includes sleep, that includes exercise, that includes diet, that includes purpose, that includes, in this context, meditation and connection to spiritual kind of practices. That has to be on the forefront of people's mind. To do the work, we almost have to be, for us to do the work, we have to be, I know my mind doesn't want to say this because I know it sounds bad, and we're not going to be, we have to be good.
Yeah.
We have to be good to be able to do the work.
It reminds me of almost like a professional athlete. When you think about becoming a professional athlete, you imagine how regimented you have to be with how you spend your time and, your diet, your exercise, your routines. And then, there's so much more emphasis now on, like, mental, social, spiritual sides for professional athletes. And you have to be good in all those arenas to be able to go, when you put on the show, come game day, you can perform. And I don't really think it's that much different for us as clinicians.
I'm having this profound, epiphany as you were saying that. We talk about this a lot, about why don't we recruit behavioral health providers like college athletes in a lot of ways, right? Like, why don't we do what college athletes, if you ever want to watch some interesting things, look at college athletics facilities, as far as like football facilities and different things about how they recruit their thing. It's like, why don't we do that in healthcare in a lot of ways?
I know, we should.
What is so amazing, right? If you had like a basketball player, right? Let's take LeBron James, because we're both big fans of LeBron James. He is very well known about how much effort and time he puts into building his body up and doing a lot of different practices. Could you imagine if LeBron didn't do that?
Oh. He wouldn't be in his 21st year.
He wouldn't be in his 21st year. And there would almost be like an expectation. My mind says, it's like, hey, what's going on? Like, if you want to be the, in the NBA, if you want to be a professional athlete, you got to take care of your body. I'm trying to think. There's been some numerous, like Luka right now. That's one of the things. No one's probably going to understand who these people are, but Luka, they're saying that about, like, hey, he's had to really focus on taking care of his body because
Luka Doncic from the Dallas Mavericks,
because he has struggled the past couple years with fatigue at the end of the season, kind of getting a little bit, because he hasn't taken care of his body in a lot of ways. And again, It's not victim blaming. It's not victim blaming. That's not what we're trying to do right now. We're just carrying that one aspect of this conversation forward. What if we looked at healthcare providers that you have to do this.
Yeah.
You have to take care of yourself to be able to practice the way we want to.
And I don't want to misrepresent any other speaker, but it really kind of drilled down to what you had said earlier, that if we haven't conquered our own universe, or, and maybe conquered is a strong word,
right?
Have in order, have some coherence in our own universe, and then we're going out there and we're trying to like conquer somebody else's universe, and then it's, like you said, if you're not good with yourself, and when we say good with yourself, meaning, you know, you're giving yourself some time to renew physically. You're giving yourself some time to renew socially, familial,
dietarily.
You know, if there was spiritually.
Yeah.
And you're like missing a big part of your life, and you go into your clinic.
I know.
And now, if you're trying to change somebody, it's kind of this irony of our field, you know, because we go into this field to help people, right?
I know.
And we say all day long, we want to help people with health behavior change. But for any clinicians who've been doing this for a while, what do we know? You can't change anybody.
Correct.
You can just help them on a journey. You can reflect back. You can give some tips and some guidance. You're alongside. You're not changing anybody. So if you're coming into this field, which many of us did, come into this field to make a difference, you're going to have to be careful about the difference between making a difference and trying to change other people and trying to conquer other people's universes.
The one speaker talked about, you know, the broad mind of our reaction in our relationship to our experiences are not dependent on people getting better or people getting worse, right? And that's a big thing that I took home too, because we all love those moments and we cling to them very much, and we should. I mean, I was glad that the speaker was very, very genuine about like, hey, it feels good. That's okay. That's okay. You just need to watch how much there's a clinginess to that my worth is being defined by people getting better.
There it is.
Or my worth is not defined, or is defined also in the opposite way of people getting worse. When we hold on to that gets us down some roads that can be difficult.
So it's not wrong to feel good if someone gets better.
Correct.
And it's not wrong to feel bad if somebody's not. It's just, if you're, like you're saying, if you're taking it to this extent of your self-worth is wrapped up in whether a patient gets better or worse, now that might be some area that you have to give it attention. And when it came down to the burnout question, if I'm remembering it correctly, it was a really simple answer. It was like, well, what can I do? It was like, take care of yourself, physically, emotionally, spiritually, socially, and all the things that we've already identified. Show up, do the best that you can, and that's it.
You know, in the other thing that I remember being said within this too is also recognizing, I think it was the second speaker that said, you have to remember your job is to help people, and we get paid to do that. Like how also recognizing almost like the moment in the honor that it is, the jobs that we get to do, that is something that is so meaningful, purposeful, valued. At baseline. And we forget about that a lot. We forget about that. And there's good reasons why we forget about that a lot, because we get eroded. We get all these different tasks, all these different things that pull us away from those things. And there's sometimes we can do more to cultivate that presentness within it.
It was like, what better way to spend your life pursuit than the very thing that you get compensated for and earn a living?
Correct.
Is to show up and do your best to help people.
Correct.
Like, remembering that before you go into clinic, remembering that whether you write in a journal or you do some type of meditation or you do some type of prayer, both or either, the beginning of the day or the end of the day, or maybe in the middle of the day, or maybe before every visit, however you want to do it. remembering, like, that's why you have this job and the honor of being able to do that. So that alone is a nice balm for burnout.
So that right there, as you said, like if it's at the beginning of the day, the end of the day, or both, of recentering.
Yeah.
This is what I get to do.
And I mean, if you think about like the term balm and burnout, you know, we're using very, like, it could be very literal.
Yeah.
You know, you picture like a burn and putting a balm on it. And if you're feeling burned out, this is a balm. And I think the other balm, like they were saying, was being so intentional with these other aspects of yourself, you know, again, the physical, heart, health, mindset, and being good with yourself when you do it. And then maybe if you're getting taken off course, when you're putting all of your self-worth into whether or not somebody gets better, when that's not really your job. Your job is to help.
Right.
Maybe it's an over attachment and over clinging to this idea that your job isn't to help people, but rather your job is to fix people and to change people.
And that's the thing also could be part of the reflective practice or whatever practice someone does, is that what am I feeling at the end of the day? Am I holding on to this thing like I need to fix this person, I need to heal this person? And if so, I need to watch myself with that. That's an inward process right now.
And where's that coming from?
And where is that coming from, right? And to be able to center yourself, it's like our purpose, and I love how you said it's just to be with people on their journey and to help when appropriate and when requested, but to be there with the journey, how much of an honor that is, and that we don't lose that. So that's the thing that I took away from it as well. And as we begin to wrap up, there was 1,000,001 different systemic things that are going on in the United States healthcare system. Those are well documented. Those are important. We need to continue to have those conversations. The thing that I loved about this retreat that we went to so much was it said, yes, and what if there's something else that's going on too? It's not, neither one's mutually exclusive.
Right.
They can happen at the same time. How much of this also is us needing to be a little bit more intentional? And I know my mind says that sounds bad. Again, as you said, don't want to be victim blaming, all those different things. That's not the point of this. It's just carrying that thought out further. What would that look like then?
Yeah, and I think these takeaways can be very practical.
Yeah.
I think the takeaways is, treating yourself and your setup like a professional athlete. We're professionals. Professional clinicians, doing that. And then if I'm over celebrating in a way that it's not just I'm happy for the patient, but I feel like I did
worth
this.
Just shot.
Yeah. And then if
you
you have a couple of tough situations where maybe somebody didn't get better, they relapse or whatever, and now you feel like you're down in the dumps, that could be a signal that maybe there's something inside of you that's a little bit out of whack. And I don't think anybody needs to panic.
Right.
But to explore that and say, are you feeling inadequate maybe in these other areas? Are you bringing something from your childhood about feeling inadequate?
Right.
And this is your way to not feel inadequate anymore. I mean, imagine the amount of pressure you're putting on patients if they have to be the ones to fix you.
Oh my gosh, well said. And again, that goes back to that statement. Whenever you notice that you're trying to conquer someone else's universe, pause.
I know how hard it is.
Maybe we need to look at other universe. So, and please send comments, emails, let us know where people's minds are going. Our prediction is that they'll probably go in a bunch of different places, which is good about having this conversation about what can be other ways of approaching
that. Yeah, I'd want to know what other folks do to kind of get right in their own mind to be able to have longevity in this field, because PCBH in particular is so new. We haven't even seen long-term, do folks stay clinicians for years upon years?
Yeah, that'd be interesting.
Or do they move out of it, And
what causes them to move out
of it? There's a lot to be discovered here. And for those of you who are watching, especially if you've been a clinician for a number of years, or you don't even just have to be a clinician, if you're working in healthcare, how have you done it for all these years?
Share that often. Well, as always, thanks for stopping by.